A very good evening, everyone, and welcome to today's workshop. So, why is today's workshop? Why did we choose the topic that we have for today? Well, every parent who's reaching out to us, for their child for autism, is asking if they can give leucovorin to their child or not, because there's so much of buzz around leucovorin as FDA has approved the usage of this drug for autism. However, we need to understand that it is not a magic pill for autism and has to be used carefully in relevant cases. So, we'll talk a lot about what really leucovorin is and how it works, in which cases it will give good results, in which cases it may not yield results and rather show a lot of hyperactivity. We'll talk about the FRAT test, which is also, which has also become very popular now. We will understand what that test is and what that really means when it's positive. So we'll talk about a lot of things, and I invite Dr. Ashwani Garg, who will be leading the session for today. We will have a Q&A towards the end, so where parents can also ask their questions. In the meantime, if you have questions, you can drop your messages in the chat. And because this understanding the nuances of such topic, you need to be attentive, and sessions like this are not organized every day. So I request parents who are here today, please keep aside whatever else you may be doing and focus here for the next 40-45 minutes, so that you can take the best from this session. You have the best takeaways. So with that, I'll hand over to Dr. Ashwani Garg. So over to you.
Thank you. Thank you, Dr. Ruhi. Good evening, everyone. Thank you so much, parents, for spending time with us. Well, it's as we understand, it's an important topic. So there is positive side to it. Of course, we have to do it carefully.
Yeah.
Is the sort of a message, but we'll try to dig deeper to understand what is at play. So what is this folate receptor antibody in the first place? So there are these folate receptors which are on various parts of the system, in the blood-brain barrier, in the placenta, ovaries, thyroid, endothelial cells, etc. And their job is to transport 5-methyl tetrahydrofolate into the brain. It's as simple as so. Receptor is taking this 5-MHTF into the brain. Okay. Thereby, what it is doing, what it is supposed to be doing. We'll discuss that also. What is now, in case there are autoantibodies either blocking them or binding antibodies which are sort of damaging the receptor, will cause a trouble. Okay. Now, if this receptor is blocked or damaged, then the brain will not have access to 5-MHF into the cells. Thereby, consequently, child will suffer. Now, in that case, when these autoantibodies are present, leucovorin comes as an option. Okay, because folinic acid can pass through other means, even the receptor is not okay. Right? Leucovorin, which is a folinic acid, high dose B9, even the antibodies is present, it can pass through the cell through other means. Thereby, it becomes a good choice. But at the end of the day, we also have to see what is causing these autoimmunity, these autoantibodies in the child. Right? Of course, when the autoimmunity is there, we can use leucovorin, folinic acid, because it can bypass that receptor, which is a fantastic thing. But the root cause of the problem is an autoimmune condition where the immune system start making these autoantibodies to that receptor. So understanding that concept is very, very critical. Otherwise, it will do a limited job. But if you understand the autoimmunity aspect of it, make the right corrections to it, there's a lot we can gain. So autoimmunity, child's own immune system mistakenly identifies this folate receptor as a foreign invader and produces antibodies against it, thereby disrupting the normal folate transport into the brain. Now, one of the reasons could be milk proteins the child could be consuming, which can cause cross reactivity and leading to a autoantibody production. So milk can be one problem which can cause autoimmunity. Viral infections, toxic metal exposure, mold exposure, gut dysbiosis, these are the things which can lead to autoimmunity. So along with temporary solution of autoimmunity of the receptor antibody through leucovorin, we have to alongside work on the autoimmunity also, which is very critical. Now, we are seeing some children are getting benefit, some are not. So it is important to understand which group of children will get benefited with the use of the leucovorin, which is folinic acid, and which group may have adverse events also. Now, children are best responders when their motor planning has an issue, their low energy is there, low dopamine tone is there, their folate levels are low in the system, but there is a absence of hyperactivity. There is no mast cell activation in the child. Okay. Now there is a issue in the language, there's an issue in low dopamine, things like that, but child is more calmer. Child is not showing aggression. Child is not showing hyperactivity. These children with no hyperactivity, no thalamocortical excess stimulation will get benefited. But a child with hyperactivity may have problems with leucovorin. So when you do leucovorin, folinic acid in these children, which are best suited for it, we will see this enhanced language, vocabulary, verbal expressions, more awareness, better social reciprocity, and better motor planning. So as the folate gets into the brain, things will get better for the child. But if the child is hyperactive, the child's immune system is hyperinflamed, there is mast cell activation, there is hyperstimulation of the brain, sensory issues are there, these children will have a problem. So when we increase folinic acid in the body, thereby dopamine can increase, thereby motivation and rewarding processing becomes better. Norepinephrine will get better, alertness and attention will get better, serotonin get better, glutamate get better, neuronal ATP will get better, methylation will get better, things like that. Okay. Now there's more excitation happening with this folinic acid, which is required in a child which is more calmer already, but there are deficits in their system. So when you increase folinic acid, you increase dopamine or epinephrine, glutamate, neuronal ATP, things like that, which is good for the child. But if a child is missing on the inhibitory system, less GABA, MAO, which is monoamine oxidase A, is poor as an enzyme, mitochondria is poor, thalamus is hyperstimulated already because of the high histamine and hyperactivity. This same folinic acid can turn these children into more excitation. Thereby, sensory chaos can happen, behavioral aggression can happen. So we have to choose the right candidate for it initially. If child is not aggressive, child is not hyperactive, it's a right choice to do. But if this is not there, then we have to look for. So which child can get worse with leucovorin? So there's something very important. High sensory load. They're already overwhelmed with the sensory load, the touch, the lighting, the sound. All of these sensory inputs can overwhelm. If already child is overwhelmed, don't do leucovorin initially. There is auditory defensiveness, extreme sensitivity to loud sounds. Don't do leucovorin. sleep is disturbed, already in a arousal state, don't do Leucovorin. The organic acid test is saying that glutamate is high, don't do Leucovorin. Extreme hyperactivity, don't do Leucovorin. If a child get agitated with methylated B vitamins, don't do Leucovorin. Already more thalamocortical hyperexcitation is there. These are the cases where we have to be careful. Even if we have to do Leucovorin, in these cases, we have to do with the support of inhibition to the excitation that Leucovorin itself will cause. Okay, so Leucovorin amplifies excitotoxic pathways in these children. Thereby, we really has to be careful. So it is choosing the right set of children with the problem for this therapy is important. We cannot give it for everybody, right? So how do we dose it? Like I said, low energy, apraxia, speech delay, but other things are fairly stable. Then we can go at a dose of 0.5 mg per kilogram to 1 mg per kilogram to 2 mg per kilogram also. We don't expect any hyperactivity or excitation in children. We can do a higher dose also. But generally start with a lower dose. Don't jump into a very high dose to 2 mg per kilogram immediately. We have to let the body process, slowly get used to it. And in case as you increase the dosing, if hyperactivity start happening, you bring down the dose already. But if a child with sensory overload and hyperactivity, we still want to enhance their speech and we want to use folinic acid. So we start with a very low dose, 0.1 mg per kilogram, almost 1/10 or 1/20th of the recommended dose. We don't go with a recommended dose. We go very slow and slowly, gradually increase the dose and see how's the child doing. Now, alongside, when a child is already hyperactive, there's already sensory overload is there. We want to improve GABA. We want to improve inhibition in the child, in the neurotransmitter. So we can use magnesium, we can use taurine, we can use theanine, and we can use any drug which can control this 5H2A receptor, which is called cyproheptadine, right? So in a child with more sensory problems already, we can use a low dose of Leucovorin along with the inhibition to the excitation, and we can improve the GABA. In a child with more aggressive problem, which is mast cell activation is already there, high histamine is already there, more allergies are there, we even go even further lower the dose, 0.05 milligram per kilogram of the dose. And in that case, we might have to use extra quercetin, extra antihistamine drugs. Okay. And we might have to do high bifidobacterium probiotic to reduce the high histamine, to reduce the mast cell activation. So this is very, very critical. What is the right group where we can go full dosing? If a group where we want to use, but we are not sure, we do a low dose and slowly increase. If we are clearly seeing there's a hyperactivity, there's more problems already in the child, we do support it with inhibitory effect to balance the excitation which would be caused by the high dose of the folinic acid. So this is very, very critical. So every parent should understand. A lot of the, we look at the paper, we look at the dosing, we straight away start the dosing because some paper is published. It's not always like that. We have to see practically what's happening. Okay. So the autoimmunity is still the missing link. We can start Leucovorin, we can start folinic acid, no problem with that. At the end of the day, we also has to look at the missing link, which is autoimmunity. Because of that, there's a folate receptor antibody being produced, right? So if we don't address that, we still suffer from worsening of the behavior. There could be a regression, there could be excitotoxicity, there could be a sleep disturbance, there could be a severe agitation. So if we stabilize the immune system, reactivities will get far more better. Thereby, Speech will have more outcomes, better attention, stable mood, things like that, developmental gains. I hope that gives you clarity. Which is the right group of children where we can use without a problem. If there is a suspected problem, we go low dose or with certain things alongside to balance the leucovorin activity. And if this is an autoimmune problem in itself, it is a good idea to solve the autoimmunity alongside. We just cannot only keep doing leucovorin. We have to look at the immune regulation. If we have to regulate the immune system, what is that we have to do? First level, of course, we have to go in a non-inflammatory diet, gluten-free, dairy-free. If vitamin D is low, we have to fix it. If omega is required, infections are to be treated, toxins are to be treated, leaky gut to be treated, we do all of that. Alongside, we can bring in thymus support, thymus peptide support to regulate the autoimmunity. As the autoimmunity will get better, leucovorin will give you better outcomes. Okay, so 3-6 months, get the basics right, especially in a child which is already aggressive, which is already hyper, which is already a child gets better and worse, gets worse and get worse and better. So cyclic things that are happening with the child. So in this cases, we get the thing straight first, then we add on the leucovorin. Okay. So like I said, when we are doing, if more hyperactivity is happening with leucovorin, you can start theanine, taurine, NAC, omega-3, magnesium glycinate, or threonate also. And still sensory hypersensitivity is still happening because the thalamocortical gating is still impacted. We can do hydroxyzine, we can do cyproheptadine, we can do magnesium threonate, and of course B vitamins, but which are not too much methylated. Okay, so if we have to do it, we take a support of certain nuances. And sometimes, the excitation can be so much so a child may get into a seizure if a child is already prone to a seizure, right? Because of the high excitation which could be caused by that. So, but if we have to do still leucovorin to improve the folate in the neurons, like I said, we do it carefully at the right dosing and with the support of other things which can play a balancing act. Hope that gives you clarity. Now we can open to the questions. Now, another very important thing, when to stop. Let's say after you started your leucovorin, your child is showing severe hyperactivity, insomnia. There's a visual stimming that has increased, aggression has increased. There's a loss of speech. There's panic, there's anxiety. If any of these things start happening, it's a good idea that you put it on pause, take a clear understanding what may be happening and do the right corrective actions before you restart it, or you restarted a very, very low dose already. Okay. But if we see better awareness, better language, better engagement, better pointing, waking up sense, motor improvement, things like that, then we can continue it till it is helping the child. Till we are seeing the gains, right? Then we can keep continue therapy. So in cases where you see improvement, you continue. If you don't see improvement or you see it is going south, there are problems, then we have to relook at it. So it's a good tool, good solution, but it is not always that it can suit for everybody. So now again, takeaway, it's an autoimmune problem. Along with leucovorin, let us look at the autoimmunity, do the right steps to fix the autoimmunity. And depending on the profile of the child, we have to dose it and we have to do the balancing act with other things also. Depends on what kind of child it is. And start slow. Okay, even though the recommended dose could be 1 mg to 2 mg per kilogram of the body weight, we don't have to start by that high dose. You can always look at the low dose and see how the child doing. So hope that gives some level of clarity. Now we can open to the questions.
Hello, doctor. I just joined late.
Just hold on 1 second,
Sorry,
Vishal. We will allow everybody.
sorry, doctor.
Yeah, you can raise your hand and we will just assign the numbers. Um, all right. So I hope parents, you have some clarity on the FRAT and leucovorin. So we will open up for questions, and I would want to keep this Q&A session more relevant for the topic, and not the discussion of if you're already on a treatment discussion of that of the child's case, because we do have live sessions for those discussions. So I want to keep the Q&A more relevant for for the purpose. All right. So we'll start. So Vishal, if you want, you can ask your question now.
Sorry for the trouble. Actually, I did not go in some sequence, but I joined a little bit late. Can I have this PPT? Second question is, uh, are there any allergic reactions? Means I'm not sure about this. I'm not from the medical stream, but can there be any situations where there are allergies, and how do we find out those scenarios, or it will be covered under this kind of test also? I'm not sure. So extremely sorry if in case I've asked any incorrect question also.
No, well,
Okay.
there's nothing to worry about the incorrect. We are learning. Now, you can look at the recording once it is available to have more
Sure.
clarity. Second is, in the brain, there's something which can cause excitation, something to balancing out, certain things which can cause inhibition. So if there's more excitation happening because of the different neurotransmitters or the supplement we're feeding, which can increase this excitatory neurotransmitters, then child can have higher hyperactivity, more trouble,
Okay.
right? So in case leucovorin is causing more hyperactivity, arousal, sleep disturbances, anxiety, things like that, means that this child is not fit for it at this point of time. Second, you can do it at low dose along with doing certain supplements or drugs to improve the inhibitory action of the neurotransmitter to balance
Okay.
the excitation which would be caused by the leucovorin.
Can there be any allergies as such apart
Well,
from
it's a
this?
it's a direct vitamin B9. We cannot expect any allergic state.
Okay. Thanks. Thanks a lot, doctor.
Okay. So before we move ahead, I have also launched a poll, and your answer to the poll will just help our team to see if any one of you needs further help from our end. So I request all of you to please answer the poll as well. Okay. Suzanne, please go ahead.
हेलो सर.
Yeah, Sujay.
हेलो मैम.
हाँ जी, हाँ
हाँ.
बताइए.
हाँ मैम, सुजैन फातिमा मैम.
या
हाँ मैम, ये टेस्ट कराने के बारे में पूछना था मैम. ये फ्रैट टेस्ट जो आ रहा है वो सुजैन को कराऊं या नहीं, कि इसके बारे में कुछ जानकारी.
अभी तो सुजैन फातिमा, अभी तो उनका हाइपर एक्टिविटी ज्यादा है ना, एक्साइटेशन ज्यादा है.
हम्म.
अगर हम
आपने
करेंगे,
लिकोरिन दिया है सर फर्स्ट मंथ में,
हाँ
वीक में 2 बार देने के
हाँ
लिए कहा है सर.
करेक्ट, लो डोज ही रखते हैं. तो
क्या वो
एनीवेज
कंटिन्यू रखूं सर?
करेक्ट, अगर तो उससे प्रॉब्लम कोई आता है तो लो और कम करेंगे. अगर उससे कुछ ज्यादा उनका एक्साइटेशन में प्रॉब्लम नहीं आता, उनके हाइपर एक्टिविटी में ज्यादा प्रॉब्लम नहीं आता, तो कंटिन्यू करेंगे. अगर कुछ
हम्म.
प्रॉब्लम दिखता है तो आपको रिस्पॉन्ड करना है टीम को कि इससे बढ़ गया है, तो हम उसको या तो डोजिंग
हम्म.
कम करेंगे, नहीं तो बंद करेंगे.
वो अब एक बात बाद में बोलता हूँ सर. सर ये टेस्ट कराना है या नहीं ये बोलिए सर.
वेल,
तो
अगर
मैंने
हमने ऑलरेडी, देखिए
हाँ.
प्रैक्टिकली अगर डोजिंग करना है हमने चालू कर दिया है, ऑटो इम्यूनिटी को करेक्ट
हाँ.
करना हम चालू, उसका काम भी कर दिया है, तो हम
हाँ.
अपने लिए प्रैक्टिकली कुछ एडिशनल बेनिफिट नहीं मिलेगा उसका.
हाँ.
सो
तो
सुजैन,
सर.
टेस्ट टेस्ट
हाँ.
अगर समझो
हाँ
आप
टेस्ट के
ऐसे.
अकॉर्डिंग दे.
हाँ, नहीं नहीं,
बोलिए मैम.
समझिए. अगर फ्रैट
हम्म.
टेस्ट पॉजिटिव आ गया, ठीक है, उसका
हम्म.
मतलब क्या, ऑटो इम्यूनिटी है बच्चे में. ठीक है.
हम्म.
ऑटो इम्यूनिटी प्रोटोकॉल हम ऑलरेडी कर रहे हैं आपके बच्चे के
हूँ
लिए,
मैम.
है
हूँ
ना.
मैम.
तो
हूँ मैम.
टेस्ट का पॉजिटिव या नेगेटिव आने से कोई फर्क नहीं पड़ेगा. दूसरी
ओके मैम.
बात, बच्चे को ऑलरेडी हम ल्यूकोवोरिन स्टार्ट कर चुके हैं लो डोज पे, है ना.
हूँ मैम.
आपका बच्चा
हम्म.
काफी हाइपर एक्टिव है, तुम हाई डोज तो वैसे भी नहीं दे सकते.
मैम एक बात बोलते हूँ, आप बुरा मत मानिए.
हाँ.
हाँ. सुजैन को ये दी थी ना मैम फर्स्ट मंथ में लिकोरिन। वो
हाँ
बहुत मीन्स बोलने में बहुत शार्प हो गई थी मैम। जैसे
हम्म
स्कूल में आपको इमिटेशन जैसे ही करती थी। तो मैंने
हम्म
सेकेंड मंथ में स्टॉप नहीं किया मैम, उसे कंटिन्यू रखा है मैम। इससे कोई
हम्म
फर्क पड़ेगा मैम?
देख
अच्छा है ना,
हाँ
कंटिन्यू करिए ना,
कंटिन्यू
लो
कर
डोज पे
सकते
कंटिन्यू
हैं।
करिए।
लो डोज नहीं दिया सर मैंने, ये डेली एक दी सर गोली।
अच्छा ठीक है, अगर उससे हाइपर एक्टिविटी बढ़ नहीं रहा है फातिमा, तो
खाली
कंटिन्यू करिए।
वोकल वोकल स्टिमिंग ज्यादा हुआ सर।
हाँ
ऐसा
हाँ वही तो,
कंटिन्यूअसली बोलते
हाँ
रहे सर।
वही तो है ना, तो कम करना है डोज को।
देखिए
ओके सर।
हाँ दीज आर प्रेस्क्रिप्शन ड्रग्स, सो बहुत जरूरी है कि आप रिकमेंडेशन के अकॉर्डिंग दे।
वो इसमें एक करी मैम, बाकी का
हाँ
कुछ भी नहीं, क्योंकि
हाँ
इतना कुछ सुन रही थी ना मैम। तो दे दूँ फर्स्ट
हाँ
स्पीच के लिए भी हम ये हो रहे ना मैम।
ना आई
स्पीच आ जाए
अंडरस्टैंड,
बस सर।
आई अंडरस्टैंड द
सॉरी मैम।
डेस्परेशन। हाँ लेकिन अगर जैसे बच्चा इतना वोकल स्टिमिंग कर आप फिर
नो
हमसे
मैम, वो
पूछते
स्टॉप
हो।
हो गया।
हाँ
1 वीक
तो
से
फिर
स्टॉप हुआ मैम।
राइट, सो
हाँ।
फिर हमारे पास सही कॉन्टेक्स्ट नहीं होता है कि क्यों बढ़ गया, क्योंकि हमें पता
ओके।
नहीं है आपने ट्वाइस अ वीक का डेली कर दिया। ठीक है।
सॉरी मैम।
हाँ
सॉरी।
ओके नो प्रॉब्लम।
ओके। थैंक यू
ठीक,
मैम।
ओके थैंक यू। रुखसाना प्लीज गो अहेड।
Yes. Hi, Doctor. Rukchana here from Sri Lanka. Good to see you after many years.
यस
Doctor, my question is, my son is currently on Levipil because he had one single episode of a seizure. So would then Leucovorin have any impact on him? Will there be an interaction with the Levipil? That's
Well,
question number one. Yeah,
most
go
of the
on.
time, Ruxana, any seizure is more excitation,
Okay.
right? And a high dose of Leucovorin may cause high excitation. So I would suggest, if we have to do it, we have to see some gains out of it. Go at a very, very low dose at first. Second, keep something to balance that out so that we don't get into seizure state again, which is like as simple as magnesium threonate. So if you continue, start with a low dose of Leucovorin and magnesium threonate and see how's the, anyway, child is on Levipil, so hopefully the cover is there.
Yeah. Right. Second question, Doctor. Child is also taking sertraline and risperidone.
Mm.
Will either of those medication interact with Leucovorin adversely or?
No, well, I think risperidone is already uh, is an inhibitor.
Hmm.
So just this 5H2 HT2A inhibitor, so it will reduce the possibility of seizure which could triggered by Leucovorin. So this comes as a good thing. Sertraline, I'm not sure what it will do. Uh,
Sertraline is currently.
I am not sure. Will it improve the serotonin pathway?
Sertraline, it's a selective reuptake inhibitor.
I
The
think,
SSR.
see, this is very critical that we understand that serotonin could be a problem in child where already there's more hyperactivity, there's more excitation, things like that. So
Hmm.
if a child is already hyper, this drug should not be used anyway, and it
Right.
can cause more excitation. So I don't know
Okay.
why
Currently,
this drug.
child is not hyper. This was put because at one point we began to notice little bit of aggression and self-harm. So he was put on serotonin to bring that while we were doing
Risperidone is
all
the
of
right.
the.
No, if you look, that's what,
Hmm.
if child is becoming aggressive, risperidone is the right thing.
Okay.
But at the end of the day, we also have to see what is causing that excitation in the first place. We can block the receptor with the drug temporarily, fine. But then we also need to work on the underlying inflammation, underlying autoimmunity, underlying histamine,
Right.
infections, toxins, all of that, which could be the trigger which is causing this more excitation, thereby self-harm and all that. So it's
Right.
okay to use risperidone temporarily, no issues, but we need to figure out the player also.
Sure, doctor. Okay. Thank you so much, doctor.
Okay, thank you. So before I go with the next one, I'll just take a question from the chat. So there is a question. My son is hyperactive, not aggressive. Can leucovorin be given?
Well, I think the low dose with the magnesium threonate as a support.
So, all right, Sri Lakshmi. So you can start with a low dose with alongside magnesium threonate. All right. Okay. Let me see if they have also raised their hand. Okay. So Triveni is asking, my kid started with leucovorin from 1 month. We see that the child is hyperactive and visual stimming aggressive. We are giving 5 mg. What should we do?
Stop it, take a break, then start the low dose.
Okay. So Triveni, you can stop it for now and then restart after a few days with a low dose. For hyperactivity, of course, you can start with magnesium threonate and see if that helps a child. Okay. Okay. Amrit, please go ahead and ask your question. Are you there, Amrit? Okay.
Hello.
Hanji.
Can you listen to me?
Yes. Yeah.
Yeah. Thank you, Ashwani Doctor, for the presentation. And 1 month back, we have started with Leucovorin with 0.5 mg per kg dose. And with that dose, we have started seeing good improvements within a week. And we have continued with the increasing dose every week. And now we are, after 1 month, we are at 2 mg per kg dose. And we have not seen any hyperactivity, and we have seen good improvements in cognitivity and motor skills, and as well as his behavior. So my question is, till what, how many days we have to continue it, and as are there any other supplements we have to add with it?
Well, I think this is only one B9, high dose B9 folinic acid. Now, first question, for how long? Till you keep seeing the gains. You can continue idly. There's no exact way to know it. Of course, blood test we can do and see. It'll, because we are feeding it very high dose, it'll be very high in the blood, which is fine. But till we keep seeing the gains, you can continue it. But the basic fundamental is, because there's autoimmunity in the first place, which is producing these autoantibodies, which are either destroying or blocking the receptor, that part has to be sorted. Now, is it leaky gut causing it? Is it diet causing it? Is it some toxin causing it? Is some mitochondrial deficiency causing it? Whatever the play which is causing this autoimmunity has to be fixed. Now, if your child is only on leucovorin gaining, fantastic, you continue, but also start looking at the autoimmunity play of it.
He's already under your continuity program, so he's already resolved a lot of things. Inflammation is down, and a lot of things are improved. So maybe that's the why he's getting much better performance with the Leucovorin.
Okay, sir. Then it's good.
So we can continue it, right?
Yeah. Yes.
Okay. Thank you.
Okay. Dilruni, please go ahead.
Hello. Hi.
Yes.
Thank you. Thank you. I'm Dilrani from Sri Lanka. Actually, we are Indians located in Sri Lanka. The thing is, we in here the doctors are not aware of Leucovorin, and so it's a little difficult to get it prescribed here. So we went through one of my friend in Singapore, is a doctor, and she said to go ahead, and we are having good results actually for the past 3 months. So my problem is like how to track his progress with the dosage, and if there are any can we do like a online consultation on this, because we are not getting help from here. The doctors are like, they don't know about this. So my question is like, now that he's
Yes.
already having good results, should I continue?
Just I answered the previous
Yeah.
person. You can continue the dose which is working for the child till the point
Okay.
you keep seeing the gains.
Yes.
Objectively, this is how it. Subjectively, this is how. Because even objectively, if we do a blood test, it will be very, very high. Now,
Okay.
second point, which is very important, is if the child still has autoimmunity, which should be fixed, right? So this is where
Yes.
the work should be done. And if in that context you want our help, we can certainly do that online. But then it
Yes.
is a far more elaborate process: diet change, lifestyle change, detoxification, all of these things.
Okay. And we keep visiting Mumbai, so will I be able to like meet and then get consultation, or
Well,
can you
online
do
is
it
fine. I'm in
online?
Bangalore, but we
Oh,
primarily
Bangalore.
work
Okay.
online.
Okay. Okay, that's so the dosage will continue because he's little he's 10 years old and 45 kilos. Still, we are giving only 15 mg per day. Should we increase, or will
No, I
as
think
it working, should it maintain the
it's
same
already
dosage?
working. You are seeing a change. You continue 15 mg, one tablet a day should be good enough.
Oh, okay. Oh, and long term use it, there won't be any effect on that. No,
Hopefully
no.
not.
Thank you. Thank you. Thank you.
Okay. Gaurav, please go ahead.
Hello.
Yes. Yeah.
Yeah, actually, my son is 2 year 3 months old, and we want to start with the Leucovorin, but my doctor has suggested not to give because he's too young for this, and he said whatever symptoms he has, he'll just come over the time. He doesn't need, but we want recovery really fast, so we want to go ahead with Leucovorin's. Is he too young for this?
Well, there's no problem with the young age. It's a vitamin which a body would need, brain would need, cells would need. But yes, based on the age, based on the symptoms, based on the condition, you can start with a very, very low dose. Like I said, point 0.05 mg per kilogram, and then slowly increase to the recommended dose and see how the child is gaining. But
See, what I have gathered, I'm sorry to interrupt. Actually, the problem is in India, the Leucovorin which is available is a 15 mg tablet form. So it is very difficult to give the doses
well,
and
I
minimize
think
the.
I hope you can get a folinic acid liquid syrup also.
Okay, okay. But it was showing out of stock. I had been searching these online sites. It is every site is showing out of stock.
Well, then in that case, what you do is you take a 15 mg of Leucovorin, crush it and put it into water, dilute it, and then ratio it accordingly.
Okay, one more question. His homocysteine is not in higher side, but in lower side, like
Low
3.5.
protein, low protein,
Homocysteine, yeah.
because of
So
low
is it
protein.
okay? So is it advisable to give him Leucovorin?
Increase the protein first, increase the
Uh,
digestion.
okay, so every day I give him eggs and some alternate day chicken. So apart from that, do we need to supplement him?
Well, if homocysteine is low, very likely proteins are low. If that is the case, either he is not eating well or not digesting well. If you're feeding him, but still proteins are low, then digestion could be a problem. First, of course, we can verify through amino acid profile, and then digestion support can be done
Okay. I would like to consult you. So you are available online only or in person also?
online.
Okay. One more question I have. Like you said, we should avoid methylated vitamins when he is on Leucovorin, right?
No, no. In case the hyperactivity is too much.
Okay, he's not hyperactive, but his sleep is slightly disturbed. So he gets up twice or thrice in the at nights for feed. He still takes mother feed. So
Well,
so we are just
that is fine. No, that is he's just getting hungry. That may be a normal process of life. No.
okay. Okay, so we should supplement him with B12 also, right?
Well,
So
I
I'll
think
interfere
that
here.
depends.
Yeah. Yeah. I wanted to understand that, he's just 2.5, right? And you should do a proper evaluation before you decide which supplements, which vitamins should be given. Otherwise, it's like shooting in the dark.
Okay.
Okay, if despite giving enough protein, his protein is low, his homocysteine is low, it's clearly evident that, probably his digestion is not so great. So please, my suggestion would be, given his age and everything, please do a proper evaluation and then, proceed with what dosage, what should be given.
Yeah, right.
Okay, we'll proceed with the other question. I'll take some questions from the chat. Are there any supplements which may interfere with leucovorin?
Well, it can cause excitation if you alongside doing other B vitamins which are methylated, more excitation can happen. So we have to look at it. Again, which one is that? I mean, this is a very open question.
And it's a very open question, Rosina. So we need to know which supplements you're talking about. Okay. Is FRAT test the right path to know who needs leucovorin?
Well, technically, yes. If your child has a positive test, he would need leucovorin, but then same time, the autoimmunity correction is also required. But a parent can simply start doing it also if a child has autism, and if the child is getting benefit out of it, probably even if you don't do it, if child is getting benefited, you can continue that also. Of course, you take your guidance from your doctor.
Okay. Can leucovorin be given to a non-verbal child?
Yeah, can be given. Well, we need to know what age and all that. Okay, what is the precedent to it? What is the progression of the problem and all that? But yes, if it is a non-verbal autistic child, yes.
Okay, and one more question I'll take from the chat. Is FRAT available in India? Yeah, we heard there is a lab in India which does FRAT tests, so you can look up.
Yeah, Yoda Labs in I think Hyderabad, and there's one more city, Yoda Labs.
Okay, all right. Gopal, please unmute and ask. I request everyone to please keep the questions short. We have a lot of people who have raised their hands.
Thank
Yeah,
you,
please go
doctor.
ahead. Yeah.
Yeah. So for my kid, we did FRAT test and many other tests actually. So we started Leucovorin, doctor. He is improving, but he didn't have any hyperactivity. But his feeding was disturbed, like he couldn't swallow it properly. And we thought it's because of something with the Leucovorin. But he has other issues like yeast, mitochondria, and Bluetooth ion issues, and even claustrodia. So, which one to focus first? Of course, we started with low doses, but now we
Well,
have other things. Do we need to do
yeah.
detox and yeast fungal infection clear first, or we can continue Leucovorin?
Well, you can continue leucovorin. It's not a problem, but parallelly you have to look at detox. You have to look at infections. You have to look at heavy metals. You look at leaky gut, mitochondria. All of that should be parallelly looked at also.
Okay. But will that affect, if we do multiple things in parallel, will that affect functionality of the Leucovorin or some other things?
Well, you see, why do we need to do a leucovorin in the first place? Because there's autoimmunity. Why do we have autoimmunity in the first place? Because there are infections, there are toxins, there are deficiencies. So
Right.
until you really fix the problem is still there. How long? You cannot lifelong do it. And there'll be a time where it will not even act. Right? Because the baseline problem is still there. If the fire is there, how much water? You have to stop the fire first. Then the repair work done. But fine, in this case, you want to do some level of repair and support, but the fire has to be stopped.
Right, doctor. But thing is that since last 2 years, if we concentrate on one area, the other area getting impacted. So everything, if we're not able to do in parallel, because it's affecting in multiple places. For example, we are trying to do his glutathione levels to be increased. So we are trying to give the glutathione injection, everything, but that's causing some other side effects in other area.
Well, then you need a right guy to guide you.
Yeah. Yeah, we signed up in the functional medicine, but
So,
of course,
Gopal, I think you've done a treatment with us quite a year back,
yeah,
right? A 3-month program a year ago and a year gap. There is no consistency, right? We do not know where the child is now, at what status. So there's
right.
no continuity in the treatment. It's very important that when we are working on infections, toxins, supporting the detoxification pathways, we continue doing what is needed.
There'll be a little bit up and down always happening. Even with only Leucovorin, you can see hyperactivity. But I'm saying then if that happens, you do take support from other things. Meanwhile, you continue low dose, right? So even you're doing single thing, that can also have some consequences to it, good and bad, right? But the baseline problem has to be solved. Else it's just a patch of work.
Yeah, yeah. I mean, we stay in US, doctor, so getting the blood work and all those things done is getting challenged actually. So every time we need to travel back to India and get the things done.
That I understand, Gopal. It's tough, but you see, we are losing time also.
Yeah.
And after some time, even it becomes even more tougher to fix it. At a
Correct.
younger age, there's a good possibility, but as the age passes by, it becomes more and more tougher.
Yep. Okay, doctor. Yeah, we'll try. So your suggestion is we can continue Leucovorin. We don't need to stop.
As long as, yes, at a dose which is suitable.
Okay, doctor.
Okay.
Thank you.
Sonali, please go ahead. Sonali, you are there?
Yes, ma'am. Hello, sir. My son is 3. During the first course of functional medicine, he, resolved the issue of dysbiosis. And now in the second course, when we done with the test, he has some metal toxicity. So does giving leucovorin affect that? How is solve the problem?
Leucovorin may help with the detoxification also, right? So we can do that parallelly. That's not a problem. It's just the right dosing.
But sorry, like he has already have metal toxicity. So does that affect? Like you are saying, you have to be like first your gut and everything should be fine, then only it will work well.
No, please understand. I'm saying if that is still pending issue, Leucovorin itself is not the solution. But you can do parallelly. You can fix these autoimmunity and whatever is causing that autoimmunity alongside. If you do Leucovorin, it's fine. But you do at a dose which is acceptable to the body.
And he also has like a vitamin D deficiency.
Well, that has to
So
be fixed. No? That's what I said.
okay, so
Immune
they
system
can go
has to be fixed.
parallelly.
Yeah. Yes.
Okay. And how like you are saying like vitamin D deficiencies, like vitamin D supplements and leucovorin, I mean, how they are related?
What is the exact question? Vitamin D will do a immune
No.
stabilization.
The vitamin B hyperactive. Like my son is not very hyperactive. Actually, I want to ask, like he's not very hyperactive and not very motivated to do things. Like we have to push him, like
Then Leucovorin
do
is the
this.
right thing. B vitamins and Leucovorin is a good thing.
But he has some like verbal stimming. He's verbal now, but he has like stimming. So does that worsen it or fix it? Like, what do you think?
See, again, we are just talking very, very without understanding the problem. But if the
Mm-hmm.
stimming increases after the Leucovorin, that
Mm-hmm.
means there's more excitation happening, and which is increasing the stimming. So you can go
Mm-hmm.
slow. But
Mm-hmm.
if there's a improvement in speech, but stimming does not increase, then you can continue the same dose.
Mm-hmm. And one more thing, sir, I want to ask, like, uh, does this help, like, if we go for a stem cell therapy in future or after stem cell therapy, we are taking leucovorin, like, how does it affect, like, it help?
Well, it can play a supportive role.
Okay. Thank you, sir.
Okay. I'll take some questions from the chat. Anita is asking if there's a regression in speech or even general regression, what should be done? So, Anita, we start with, I think you've been with on our treatment. So, like how, how we evaluate everything and then we look at where the imbalances and start addressing them. So that's how we would go about again if your child has regressed now. So Sarika, you are already under our treatment, so you can ask the assigned doctor regarding if we should start leucovorin for your child or not. We have your child's case. So if you ask the assigned doctor, we will advise you. Okay. Rahul Berry, please unmute yourself and ask.
Hi, Namaskar, ma'am.
Yeah.
It's a pleasure to have you all over here. Just wanted to have a quick question. My son is 8, Rudra Berry. You have his case on with you. He's not hyperactive. He's not aggressive. He's a very happy child. That's what we as parents see. But of course, he has difficulty in forming words. He has speech. We are going through different speech therapists. And he has words when you ask, but there is a difficulty in imitation of them. And also, we see him. Certain things which are in terms of education are coming as a difficulty, writing and so on and so forth. So of course, we are on your plan. We are going through the FMC program throughout, but would like to understand leucovorin, because of course, once I heard Trump's interview and everything, it was very much intriguing to find out that there is something like a highly activated folic acid which is there to be given to the child. So I just want to understand, would Rudra, do we have to go for the FRAT test and only then we go for leucovorin for Rudra, or how do you suggest about it?
Well, we can start without a FRAT test also. That's no problem.
Right. So, do you think he would be a classical case, for leucovorin to go for him?
We can start, Rahul, and then see the outcome to it. Like I said, objectively, if we do a FRAT test, we have a clarity. There's autoimmunity, receptor is blocked. Let's do it. But
Right.
without that also, if we do it and we see a progress, fantastic, job is done. If we don't see a progress or we see otherwise, then we reevaluate the indication.
So you suggest that a designated doctor should be able to give us a bit more clarity onto this.
Well, we can start it, like I said.
Right. Thank you very much. Thank you, sir.
Okay. So I'll take a question from the chat. Santosh is asking, we have done stem cells. So this is for his 2 kids. And recently they've done the intrathecal stem cells with us.
Mm-hmm.
So what's your thought on starting leucovorin? Should we wait some more time?
No, we can start. There's no problem.
So Santosh, we can start leucovorin for both of your kids. Okay. Okay, does the child need to take lactose-free leucovorin?
Well, I think the tablet is tiny, which is holding 50 mg of it, but maybe the fillers of the tablet may have some lactose into it. It's a good idea to do a lactose-free.
Yeah, if you can get lactose-free, yes, it's a good idea. Okay, Nirendra, please ask your question.
Yeah, thank you, ma'am. Actually, my daughter is Navya Thakur, and she was already on FMCG plan almost 2 years back. And then we had almost 1 year of treatment done. Then we had also done some kind of ozone therapy and all. Then we moved to Ayurvedic and all. So as of now, she's on Ayurvedic and all. And recently I have started, she's almost 10 years old and almost 30 kgs. So I got this folinic acid 800 mcg basically. So I think hardly, I think 1 week back I started. So initially, maybe I think there was something called, we started some neem also. But the morning giving that, as of now, that is famous, the neem therapy and all. So we started. So whether it was due to that or due to this leucovorin, we didn't know. But there was some kind of unusual laugh and all.
Mm-hmm.
Then again, we reduced the dose further. I think 800 mcg is already too low. I got some generic medicines and folinic acid. So then I made it alternate.
It should not be folic acid. It should be folinic acid.
Yeah, it is folinic acid. I got it. Someone was coming from US, so
Okay.
I got it through them. And so then I made it alternate. But as of now, I'm not seeing. It had been hardly 1 week, and then with that, I'm giving that B12, sir. So should I do something else or?
The neem therapy, which is recommended by Dr. Vishwarup Chaudhary.
Yeah, Vishwarup Chaudhary, yes, sir.
Neem is a good thing, but the doses recommended are pretty high, which can cause die-off, and the die-off can cause a self-laugh, for example.
Correct, sir.
So maybe you also need to titrate down the neem therapy also.
Okay.
To her, one is based on the the weight of the body, we are dosing something. But if that dose is too much to the body, we have to titrate down, because there are more infections. When you give a neem, neem therapy essentially is looking at the microbiome only. It's only one part of the game. It is, but if itself is causing the die-off and thereby more metabolites and more excitation and more
Correct, sir.
so you slow down the neem also, then try to see which is the play which is causing it.
800 mcg is good. Basically, she's almost 10 years, still non-verbal, I would say, but she's still repeating the words. Whatever sentence I'm saying, she will repeat that word. She will repeat it. In terms of academics, she can just stroke down a line or something like that, not beyond that.
Well, see, again, neem therapy will not do anything on the brain part. Very unlikely that it will help the brain part. It will help the infection, thereby consequently the infection outcomes may get better, but dosing has to be titrated. What you started is almost 1 mg of the your Leucovorin, folinic acid, which is, if it may not be enough to supply enough of that if autoimmunity is persistent in the body.
Should I increase it basically?
No, but now your problem is it is causing self-laugh. Then you don't know which one is causing self-laugh.
No, then what I did is I also already tried one thing is I stopped it, but I made it alternate. And then I saw ki after that I stopped neem also, as you are saying. I stopped neem. Then I saw ki matlab, since it is just 800 mcg, I am not seeing any matlab negative or
अगर
positive.
आपने नीम बंद कर दिया, slowly increase the folinic acid and see how it is helping. If there's no reactivity, you keep increasing to the recommended dose of almost 1 mg per kilogram. Maybe in this case, almost 2 tablets of Leucovorin in a day.
This is 800 mcg is actually less than 1 mg, no, sir?
Less than 1 mg. So the recommended dose is 1 mg per kilogram or 2 mg per kilogram. If she's 30 kg, the ideal dose almost to 30 mg to 60 mg. So one tablet of Leucovorin is 15 mg.
Okay.
So one tablet or 2 tablets for her age, but start with 1 tablet and see how she's responding.
But what I have got is of 800 mcg. So that means this.
See, Leucovorin is something which is easily available on any chemist store.
Okay. Okay, so I should use that only on the chemist store only.
If you have to titrate up the dose, that's a better option.
That's a better option. Okay. Thank you, sir. Thank you very much.
Okay, we'll quickly wrap up now. Baljinder, please ask, keep your question short. Okay, Baljinder.
Hello.
Yes.
Good evening, ma'am. Good evening, sir.
हाँ जी बलजिंदर.
हाँ सर, आपको तो जस प्रताप के बारे में पता ही है, तो उसको क्या करना है, देना है
उनका तो हाइपर एक्टिविटी ज्यादा है ना?
नहीं सर, हाइपर एक्टिव नहीं है वो। आफ्टर मेडिसिन के बाद ऐसा हुआ है, बट वो नहीं है।
नहीं, जो भी हम कर रहे हैं उससे हाइपर एक्टिविटी बढ़ा है ना उनका?
हाँ, अभी लेकिन ठीक है। कुछ दिन से जो मेडिसिन न्यू स्टार्टेड हुई है, विजुअल स्टीमिंग, जो प्रॉब्लम थी आगे से कंट्रोल है।
ठीक है, देन वी कैन ट्राई। आप एक बार अपना असाइन डॉक्टर से बात कर लो, वी कैन ट्राई Leucovorin.
Okay, sir. Okay. Thank you, sir. Thank you.
Okay. Prudvini, if your question is the same that you asked in the chat, then you can give all the details to the assigned doctor and we will advise on the dosage. Is that the case? Oh, sorry, who's talking?
मैम आई एम अर्पिता मैम, मेरा नंबर
अच्छा, मैं आपको भी अलाउ करती हूँ.
ओके मैम.
Okay. Okay, so Prudvini, if your question is the same what you have asked in the chat, then I'm skipping your question. ठीक है, अर्पिता पूछिए.
हेलो सर.
हाँ जी अर्पिता.
हाँ सर, एक्चुअली उस अर्चिस्मान में सर अभी मतलब हाइपर एक्टिविटी तो उसमें नहीं था पहले, लेकिन ये जो 6 कंटिन्यूटी में सर फर्स्ट महीने का सप्लीमेंट लेने के बाद सर उसमें हम लोगों को लगता है फिक्सेशन वाला इशू बहुत आ गया है सर। मतलब हाइपर एक्टिविटी भी है, डॉक्टर अपर्णा से मेरा बात हुआ था, और फिक्सेशन वाला इशू जो है वो बहुत ज्यादा आ गया। तो सर ये और गांठ इशू तो उसमें है, तो सर ये ल्यूकोवेरिन एक गांठ इशू में कुछ हेल्प करेगा या नहीं?
वेल आई थिंक इतना डोज में गट इश्यू में तो नहीं चाहिए, ब्रेन में ही चाहिए क्योंकि एंटीबॉडी के लिए। तो अगर
ओके
लैंग्वेज में, उनका मोटिवेशन में, उनका लो डोपामीन स्टेट है तो उसमें तो हेल्प करेगा।
सर, लैंग्वेज अंडरस्टैंडिंग तो सर पहले से बहुत अच्छा है, उसमें तो बहुत ज्यादा
हम्म।
अच्छा हुआ है। लेकिन
तो
सर उसका जो मेन इशू है अभी लगता है सर फिक्सेशन, मतलब उसको पैरासाइटिक क्या चल रहा है
हाँ,
इसके वजह से, या फिर कुछ फिक्सेशन बहुत ज्यादा बढ़ गया सर, और जो पहले नहीं था सर। और गांठ इशू तो सर है ही। तो सर
कॉन्स्टिपेशन
इसमें
भी है
क्या?
क्या?
हाँ हाँ सर, कॉन्स्टिपेशन मतलब वो सेना का डोजेस हम कम कर रहे हैं अभी। हैप्पी बावेल हमने ऑर्डर किया है। तो सर पहले तो आपने दिया था, वो पहले फर्स्ट या सेकंड कंटिन्यूटी में उसने लिया था। तो उसके बाद तो सर जब आप बंद कर दोगे सप्लीमेंट तो वो नहीं होगा, मतलब हर रोज आपको 1 टैबलेट देना पड़ेगा। ऐसा है। हाँ।
राइट।
तो सर अभी क्या दे
नहीं,
सकते हैं हम ये?
नहीं, लिकोरिन का तो मुझे लगता नहीं एक्स्ट्रा बेनिफिट आएगा इसके ऊपर।
ओके। तो सर नहीं देना है क्या?
मेरे को लगता नहीं बेनिफिट आएगा, फिर भी अगर ट्राई करना हम ट्राई कर
नहीं
सकते हैं।
नहीं सर, नहीं नहीं सर, ओके ओके। तो सर उसका जो अंडरस्टैंडिंग स्पीच है वो काफी हद तक अच्छा है, तो ये देने में से क्या और अच्छा होगा? मतलब जैसे कम्युनिकेशन में थोड़ा गैप है, मतलब हाँ, पहले जैसा
नहीं
डिस्क्राइब
देखिए,
नहीं कर पाता।
नहीं आपको
हाँ।
ये समझना है कि लिकोवरिन क्यों हाई डोज में दे रहे हैं, क्योंकि रिसेप्टर को ब्लॉक
अच्छा
करने की
नहीं
एंटीबॉडी है।
आप ऐसा
अगर वो एंटीबॉडी नहीं है तो हम हाई डोज देंगे तो उससे कुछ फर्क नहीं पड़ेगा, क्योंकि उसका कमी तो था ही नहीं फर्स्ट प्लेस में। और
हाँ
लैंग्वेज
हाँ।
में, कम्युनिकेशन में अभी भी अगर दिक्कत बनी हुई है तो ये नहीं जरूरी है कि B9 का ही डेफिशिएंसी है, देयर अदर इश्यूज आल्सो।
ओके ओके
तो मुझे
ओके
लगता नहीं है कि, फिर भी हमको ट्राई करना है तो करने में तो कुछ भी हार्म नहीं है, ट्राई करने में तो एटलीस्ट वी वुड हैव दैट चेक्ड आउट, ये कर लिया हमने।
ओके सर। तो सर ये 2 महीने का प्लान जो है वो खत्म होने के बाद क्या मैं आपके साथ इस बारे में बात कर सकती हूँ? मैं तब जब अब नई तरह से प्लान
तो आप
होगा,
डॉक्टर
नई तरह से
अपर्णा को बोल
टेस्ट।
दीजिए, वी लुक एट द प्लान एंड देन प्रिस्क्राइब द राइट डोजिंग।
ओके ओके सर, ओके सर, ओके सर, थैंक यू सर।
Okay, all right. Asim, please ask your question.
डॉक्टर साहब ये थोड़ी कंफ्यूजन है, आपने भी बताया कि अगर जो बच्चे होते हैं, मतलब आप मिनिमम जो डोज होती है 0.8 mg जो है ना वो देनी है पर केजी, लेकिन हमें जो डोज दी गई है वो तो मेरे ख्याल से ऑल्टरनेट डेज पे 1 टैबलेट, या हमारी अंडरस्टैंडिंग में कोई वो है?
देखिए सर, रिकमेंडेड डोज है 1 mg पर किलोग्राम टू 2 mg पर किलोग्राम। अगर बच्चा 30 किलो का है, 30 mg टू 60 mg पर डे।
अच्छा, तो खैर हमारे शायद हमें ये बताया गया था कि ये हमने गलत समझा था कि 0 पॉइंट।
आपके, हाँ, नहीं 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 सर, मैं जो रिकमेंडेड डोज है, जिस
जी
बच्चे
जी
में ऑलरेडी ज्यादा एक्साइटेशन है, हाइपर एक्टिविटी है, सेंसरी
जी।
इश्यूज है, उनमें हम 0.1 mg टू 1 किलोग्राम और 0.05 mg टू 1 किलोग्राम बहुत लो डोज से चालू करके, क्योंकि उसमें प्रॉब्लम आता है बच्चों को।
नहीं, हम तो तकरीबन समझ लें अप्रैल से दे रहे हैं 0.8 mcg, यानी मतलब 800 mcg, जो कि 0.8
वो तो बहुत
बनता
लो
है।
डोज दे रहे हैं, हाँ जी। वी आर जस्ट गिविंग वेरी टाइनी डोज ऑफ इट, यस।
तो उसको हम बढ़ाएं या वही रखें अभी?
नहीं, अपने बच्चों में हाइपर एक्टिविटी एक बड़ी प्रॉब्लम है सर।
अच्छा। हाँ, नहीं हाइपर एक्टिविटी नहीं, एक में तो कॉन्स्टिपेशन का इशू है, एक का ये है कि वो किसी को ना हिट कर रहा है, वो मतलब बैठे बैठे
करेक्ट।
लोगों के हिट कर देता है वो, बस
हाँ सर, वो
और
एक्साइटेशन
जी
है ना ज्यादा।
जी जी।
वही वही है, अभी ज्यादा डोज नहीं कर सकते।
अच्छा, वही रखें, एक टैबलेट रखें ऑल्टरनेट
हम्म।
डेज पे?
हाँ सर, हाँ।
अच्छा, चलें ठीक है, ओके
Okay.
ओके।
Disha, please ask your question. Nisha Kumari.
Hi,
Yeah.
doctor. I'm attending your seminar for the first time. I got your reference from one of my friends. My daughter is 8 years old, but she was quite very hyperactive. With age, it has mellowed down, but the hyperactivity is still there. She has excitement problem as well, and she has sensory issues. Mm, Everything is subtle, not too much, but she has all these things. And I've been mean to check if I can actually start dose of Leucovorin or not. So, what is the steps that I should take? Should I consult you guys first? Because
Well,
I'm sure I cannot take
Nisha,
it.
what is the purpose you want to solve with Leucovorin? Let's first get
So,
that straight.
uh, she has speech, but she
Hmm.
doesn't have communication. So she
Okay.
has understanding issues wherein she cannot link to your question and respond. She
Okay.
can very well communicate her need in words, obviously
Right.
not in sentences. But I mean, it's very basic. It's very basic. Like
ठीक है.
she
ठीक है,
cannot communicate most of her time.
fair. So yes, we can do it. We can do it. Of course, if we see increase in whatever little bit of hyperactivity, things like that is there, then we go at a low dose and slowly
Because
increase.
I keep on I need to settle down her sensory needs and hyperactivity with her food and all those stuff on a very regular basis. So if she eats junk food, it will show up like immediately. So if I
Exactly.
restrict her diet, so these are like quite few things, and I was very not sure if I can start, by my own. So definitely I was looking
Well,
for someone who would.
yes, if you want our help, we are there.
Okay. So I should take a consultancy, right?
Hmm.
Awesome. Thank you.
Okay. Anita, please go ahead.
Hi, doctor. This is Anita from Sri Lanka.
Yes.
I have done the program with you about
Yeah, I
3
remember.
times and
I remember.
saw good results. On recovering, doctor, I started my son with 15 mg, but I saw there was a regression in speech.
Okay.
And the verbal stimming also went down. So I stopped it, and after about a month, I am giving him half now. For that 7.5, for that, I do not see any positive nor negative changes. Like there's no change. So I just wanted to ask why, and does this mean that recovering will not work for him, and no point for me to look at that path, is it?
Well,
And
I
just
think
to mention, sorry to interrupt.
If it's been a month since you have been doing every day, whatever half dose, and there's no change, we can try for one another month. And there's no change, I think this is not going to help.
Okay. Thank you, doctor. Thank you.
Okay. Gautam, please ask your question.
Hello, hi both. Gautam from Bangalore. So we heard about you about 2 weeks back, and then I think I spoke to you, Dr. Ruhi. And somebody contacted from your office. I just wanted to ask if it is possible to have one consultation face to face, as I'm based in Bangalore and your office is also in Bangalore.
So, Gautam, like I think I had explained you during the call also, doing a face-to-face consultation is not going to add any extra benefit to the treatment line for your child. ओके बच्चे को देखकर हम कुछ एक्स्ट्रा कर पाएंगे ऐसा बिल्कुल भी नहीं है सो आवर मॉडल इज कंप्लीटली ऑनलाइन एंड वी डू नॉट डू ऑफलाइन कंसल्टेशंस
Okay.
या एंड लाइक पेरेंट्स कई बार पूछते हैं कि बिना देखे बच्चे को आप कैसे हाउ विल यू डू द ट्रीटमेंट इट वी डोंट वर्क लाइक द कन्वेंशनल मेडिसिन वेयर we have to see the child and prescribe anything. The data for us is in the form of the history form, which is very comprehensive, and we collect that data. आपको काफी time spend करना पड़ेगा वो history form भरने में, and then we do very detailed investigation. That is the information we need for planning the treatment.
Yeah, at least for that assigned doctor, if we can, if available in Bangalore, right, would like to have that discussion about.
Again, it's the same thing, whether me
Okay.
or our assigned doctor, right? None of us are going to do anything different with a offline consultation.
All right. Thanks for your time.
Yeah. Okay. Lakshmi, please ask your question.
हेलो डॉक्टर, मैं एलिना का फादर बोल रहा था। सर, मैंने एलिना को अभी लास्ट 2 डेज से 15 mg का ग्लूकोविन चालू किया है और उसका वेट है तो एलिना का 30 kg है और एज है सर 8 ईयर 2 मंथ्स। तो सर, जैसे मैं ये पूछना चाह रहा था कि पहले मैं आपसे बात किया था तो आपने बोला था सर 2 दिन के लिए आप ट्राई करके देख सकते हैं बोल के, तो क्या मैं इसको कंटिन्यू करना है कि सर ब्रेक कर करके करना है? फर्स्ट क्वेश्चन ये था।
पहला
और
चीज तो
सेकंड
वही
सर,
है, अगर हमारा पर्पस क्या है, अगर पर्पस अलाइंड है, आपने चालू किया है, चालू रखिए। अगर कोई प्रॉब्लम आता है तो बंद करना है, डोज लो करना है। अगर बेटरमेंट आता है तो कंटिन्यू रखना है या डोज को बढ़ाना है। अगर कुछ भी नहीं होता है तो मे बी इट्स नॉट द इवन द राइट थिंग, तो बंद करेंगे।
सर इसमें कैल्शियम होता है ना, इसमें कैल्शियम और फोलिनिक एसिड होता है ना सर, दोनों का कॉम्बिनेशन है ना चाहिए?
करेक्ट, आई थिंक कैल्शियम फॉलिनेट कुछ नाम, हाँ।
जी जी। तो सर जैसे अभी 2 मंथ से प्लान चल रहा है एलिना का एफएमडी से, तो उसका कैल्शियम लेवल जैसे विटामिन डी दे रहे हैं तो अभी कैल्शियम लेवल उसका 9.5 है सर अराउंड। तो क्या
ज्यादा है
अभी
क्या?
मैं सर लास्ट टाइम ब्लड टेस्ट में बॉर्डर लाइन में ना थोड़ा सा हायर साइड में था,
तो
तो
वैसे
क्या
तो
हम?
विटामिन K2 हम रखते हैं साथ में डी के साथ, तो K2
जी
विल टेक द कैल्शियम टू द बोन्स।
जी जी। तो सर अभी क्या मैं केटू को यानी विटामिन डी को स्टॉप कर करके इसको पैरेलल चलाऊं कि दोनों मेडिसिन कंटिन्यू रहेगा सर? विटामिन डी और केटू तो है साथ में कंबाइंड।
हाँ, चाहिए तो एक्स्ट्रा K2 कर सकते हैं हम लोग, अभी कुछ वरी नहीं करना। 3 मंथ करेंगे, रीटेस्ट करेंगे, अकॉर्डिंगली विल गो हेड।
नहीं, मैं इसलिए पूछा सर, ये जो हम फोलिनिक एसिड चालू कर रहे हैं
और
इसके लिए
इसमें
मैं
तो
पूछ रहा
बहुत
था इसमें
माइल्ड होगा, अगर कैल्शियम है भी तो बहुत ज्यादा नहीं होगा इसके अंदर।
कोई इशू नहीं है ना सर?
नहीं नहीं।
अच्छा, तो सर 15 mg राइट है सर? 15 mg अभी दे सकते हैं ना
हाँ,
कंटिन्यूसली?
चीज 30 किलो तो कोई प्रॉब्लम नहीं है। उसको
ओके।
मॉनिटर करना है कि क्या आउटकम है।
जी जी सर, ठीक है सर, ओके सर, थैंक यू।
शीतल।
या हेलो मैम, गुड इवनिंग।
गुड
गुड इवनिंग
इवनिंग।
सर।
अच्छा।
सर अवधूत जो है अभी 3rd मंथ प्लान में है और हमने ल्यूकोवरिन उसको लेट स्टार्ट किया है और मोस्ट प्रोबेबली आपके इससे प्रेजेंटेशन से लग रहा है कि वो बी टाइप प्रोटोकॉल में है विद सेंसरी ओवरलोड एंड हाइपर एक्टिविटी। तो सर ये जो आपने को फैक्टर्स बताए हैं तो वो अभी प्लान खत्म होने में थोड़े दिन रह गए हैं, सो शुड आई आस्क द डॉक्टर टू इंक्लूड दीज को फैक्टर्स?
नहीं, अगर शीतल, तो पहला तो है कि अगर उससे हाइपर एक्टिविटी सेंसरी इश्यूज बढ़ते हैं,
हाँ सर, बड़े हैं।
बड़े हैं, तो हम
हाँ,
कुछ त्रिनेट यूज कर लो एक बार।
ओनली वन सर कि ये मतलब मैग्नीशियम तो ऑलरेडी शुरू है, सो
ठीक है, आप एक बार टीम को बात कर लो, सो मैग्नीशियम को रिप्लेस करके मैग्नीशियम त्रिनेट यूज कर लेंगे हम लोग।
ओके ओके
एंड
सर।
देन सी इफ इट इज एबल टू बैलेंस इट आउट।
सो
बैलेंस हो गया तो ठीक है।
सर ल्यूकोवरिन फिर 3 मंथ्स तक करना है ना, मिनिमम 12 वीक्स ऐसा कुछ है?
नहीं, वेल, जब तक गेन्स है, जब तक उसका गेन हो रहा है तो यूज कर लेंगे।
ओके, सो गेन तो ऐसे तो कुछ दिख नहीं रहा है, वी आर जस्ट वेटिंग फॉर अ ब्रेक थ्रू कि कुछ ल्यूकोवरिन से कुछ गेन हो जाए।
ना देखो शीतल, ये जरूरी नहीं कि ल्यूकोवरिन का ही प्रॉब्लम है, प्लीज अंडरस्टैंड दैट। जिस
या
बच्चे में
सर।
एंटीबॉडी प्रेजेंट है अगेंस्ट फॉलेट रिसेप्टर्स, वहां पर गेन होने के चांसेस हैं। देयर आर सो
ओके।
मेनी अदर इश्यूज which could be the still at the play, है ना?
सो
तो
वैसे
जरूरी
उसका
नहीं कि उससे होगा कि नहीं होगा। एंड वैसे भी अपने ट्रीटमेंट में हम लोग हमेशा B9 रखते ही हैं, हाई डोज नहीं रखते। मिनिमम B9 तो हमेशा देते रहते हैं हम लोग।
ठीक है सर। ओके सर, थैंक यू।
Okay. Abdul, please ask your question. Abdul, you are there? Okay. Prudvini, are you there? Okay. Zahid? Okay, so this
Hello,
is the
hi,
last.
hi, sorry. I was on mute. Yeah, Pradhini is my sister.
Okay.
Yeah, so she would like to understand why is like the kids' creatine level is so high even after not giving any supplements.
Which creatine? Is it serum creatine, urine creatine?
Urine creatine, urine creatine.
Dehydration could be one problem, or some inflammatory processes which is causing some damage to the muscles and all that can increase that.
Oh, okay. So, like, do we need to do anything and just hydrate the kid or hydration?
Hydration is certainly critical, and on the top of that, anti-inflammatory things that we anyways do.
Oh, okay. Sure. Okay, thanks, doctor.
Okay. Abdul, you are now available.
Hello, good evening, ma'am.
Good evening.
This is Abdul. I'm connected from USA. Yeah, I have two autistic kids. My daughter is 6 years old. My son is 8 years old. I have done a lot of, like 3 times stem cell therapy in Mumbai Neurogen. And I follow all the protocols like folinic acid, magnesium, Autonorm, and all those stuff. So I have seen a little bit change on my daughter. She is verbal now. She can talk, but not communication. But for my son, he is on zero word. Uh, Even he's not talking. Uh, I'm not sure what should I do next to help him, like should
Well,
I do any?
yes. So Abdul, one part of the problem which is immune dysregulation, which is leading to autoimmunity. And immune dysregulation could be caused by, let's say, certain infections, leaky gut, food itself, heavy metals. So this is the baseline which is triggering all the problem. Now, when we put stem cells in the spine, we target the brain health, which is good. But there's still immune health, the toxins, the infections, which is still pending. If any work is not yet done on toxins and infections and immunity, probably it's good to look at that part.
Yeah, we are doing the gut protocol as well. Like we are giving them the treatment for the gut. But my kids, I haven't seen any leaky gut or constipation on them. But it was pretty bad before. Now it's okay, like according to the tests. So the microbiome test says 3. The number is 3. Before it was 0.5.
Don't worry about the scoring, Abdul. Look at the infections. Microbiome report will have reporting of the infectious pathogens. Look at them. If they're present, the work still be pending. If there's no infection present, then probably job is done. Then we have to see what else is to be done.
All right. Thank you so much, doctor.
Yeah. All right.
All right. So one last question. Zahid, please ask your question. Zahid, are you there? Okay, I'll take a question from the chat. Please elaborate on the difference between Leucovorin and MTH5 supplement, which is better?
Well, I think that's the thing that Leucovorin is folinic acid, and when there is autoimmunity of the receptor, then folinic acid is the right dose to be right supplement to be done in terms of B9. Okay, for the brain cells where folinic, those antibodies are present, receptor antibodies are present. But otherwise, in the other cells, you still need methylated B9, right? Alongside of folinic high dose, we can still do methylated B9 at a lower dose and then see how the body is responding to it. But let's say there's no autoimmunity, there's no folate receptor antibody present, then only B9, methylated B9 is good enough. So it's not that they're better than each other. It just each of them serving some purpose.
Okay. Zahid, are you here now?
Yes. हेलो डॉक्टर
Yes.
हेलो सुन रहे हैं आप बात
हाँ जी, हाँ, आवाज आ रही है, आप बताइए।
बेसिकली मैंने ना परसों कुछ टाइम पहले पूछा था क्वेश्चन रिगार्डिंग फ्रैट कि यहाँ इंडिया में होता है कहीं किसी जगह पे ये
होता है साहब, हैदराबाद में होता है साहब।
हैदराबाद में होता है, लेकिन हम वी आर लिविंग एट अ डिफरेंट, वो ऑनलाइन कुछ ऐसे प्रोविजंस हैं?
नहीं, हमने उनके साथ बात करने की कोशिश की, वो लोग बोले कि हम पार्टनरशिप नहीं करते हैं, तो प्रोबेबली वहीं जाके सैंपल देना पड़ेगा। फिर योदा लैब है, द नेम ऑफ द लैब इज योदा लैब इन हैदराबाद। आप उनसे बात कर लीजिए एज अ पेरेंट,
ओके,
if
ठीक
they have any distant pickups and all that, please talk to them and see.
ठीक। जैसे आप बता रहे थे अभी कि हम ल्यूकोम वैसे भी ले सकते हैं,
हाँ,
वेदर वी
ले
डू
लिया,
टेस्टिंग,
अगर
वेदर वी
बेटर हो रहा है तो कंटिन्यू करो, अगर नुकसान हो रहा है तो बंद करो, नहीं तो लो डोज करो। अगर कुछ भी फायदा नहीं हो रहा, थोड़ा दिन ट्राई करो, बंद करो।
हाउ टू स्टार्ट विद दिस, हाउ टू स्टार्ट? जैसे इफ वी वांट टू स्टार्ट विदाउट डूइंग द फ्रैट, तो हमें स्टार्ट कैसे करना है? जैसे आप बता रहे थे कि इट शुड बी 0.8 पर केजी वेट के हिसाब से।
तो 0.5 mg पर किलोग्राम, अगर 10 किलो का है 5 mg से चालू कर सकते हैं।
कोई any other precautions while taking this leucovorin, जैसे कि मिल्क वगैरह का कुछ ऐसा होता है कि मतलब
नहीं,
नथिंग?
वो तो पहले करें कि उनका ऑटो एंटीबॉडी अगर प्रेजेंट है तो मिल्क को बंद रखना है।
तो
सो
अभी
जाहिद,
कैसे?
आप ऑलरेडी ट्रीटमेंट में हो हमारे, राइट? आपको ऑलरेडी ये डाइट रिकमेंडेशंस तो दिए हुए ही हैं, वो तो
जी
आपको
जी,
करना ही है, ठीक है।
दैट वी आर डूइंग ना, दैट वी आर डूइंग एक्चुअली।
यस, तो फिर तो मिल्क आप दे ही नहीं रहे होगे बच्चे को, वो
नो
कंसर्न
नो
है,
नो, लेकिन
राइट?
हम दे रहे हैं, वी आर गिविंग मिल्क, हम केमल मिल्क देते हैं ना, केमल मिल्क
हाँ,
देते
सो
हैं।
कैमल
कैमल
मिल्क
ठीक
इज
है।
फाइन, दैट्स नॉट अ प्रॉब्लम, आप वो दे सकते हैं।
चलिए ठीक है मैम। और भी कोई, जैसे म्यूजिक थेरेपी जब मैं स्टार्ट किया था ना, तो आपने कोई साउंड और म्यूजिक थेरेपी का बोला था
हाँ,
कि इफ समथिंग इज नॉट वर्किंग, तो ऐसे प्रोविजंस भी है तो?
हाँ, वो
साउंड,
सेशन
हाँ,
करवा देंगे सर। हमारा जो प्रैक्टिशनर थे, शी वाज नॉट डूइंग इट फॉर सम टाइम, नाउ शी इज विलिंग टू डू इट, सो
ओके,
विल अरेंज द सेशन।
मतलब वही, क्योंकि आई थिंक दैट शुड हेल्प द चाइल्ड। जैसे मैं
हाँ,
पढ़ रहा
बिल्कुल
हूँ, म्यूजिक का
बिल्कुल।
काफी इफेक्ट है ऑन द पैटर्न्स एंड द रिदम्स जो अंदर से हैं, तो उस पे वो काम कर सकते हैं।
करेक्ट करेक्ट करेक्ट।
चलिए, थैंक्स थैंक्स।
ओके, थैंक यू। All right. So, thank you all of you for joining today's session. I hope it was useful. Uh, okay. I hope the session was useful. Our next session would be, well, I hope you have joined the community. You will be informed there about our next workshop. Um, and again, it will be a different topic, which will be to create awareness among the parents, on different aspects of the spectrum. So with that, we will wrap up for today. Few of you have answered the poll, so accordingly, our team may get in touch to help you further. Thank you so much. Have a great evening.
Thank you.